to chapter 2. Again, please make sure you read the chapter. You're responsible for all the information. All right, before you take your quizzes. So fluid, electrolyte, and acid-base imbalances. So just a little bit of review about the body. The major component of the body is water, and it is found in the intracellular fluid compartment and the extracellular fluid compartment. Intracellular when he's inside, and the extracellular is outside. And that should be intracellular. About 60% of the adult's body weight is water, and if we look at the infant, it's about 70%. We typically see more water in males and less in females because females typically have a higher fatty tissue percentage. Also, in older adults and obese persons, they also have a lower proportion of water. Individuals with less fluid reserve for their body are more adversely affected from electrolyte imbalances and fluid imbalances. So we have the intracellular fluid compartment and the extracellular fluid compartment. Intra means inside the cells. This is where the majority of fluid is. Extracellular is everything outside of that, and we can break this down farther in the intravascular, which is the blood, the fluid in the blood. Interstitial, which is the fluid in the tissues that surround the cells. This is the tissues around the tissues in between the cells. We also have the cerebrospinal fluid, which is inside the ventricles of the brain and also the spinal canal, and surrounds the spinal canal. Transcellular fluids that are not in the other categories, so like in the synovial cavities in our joints, fluid there, the fluid in the heart, and then also the fluid in the abdominal pelvic, the serous fluid in the abdominal pelvic region. You can see here's a breakdown, and we can see it male versus female versus an infant. A lot of the figures you see historically have been the ones they quote a lot is the male. You do need to know there's a difference between the male, female, and the infant. And we can see that percentage-wise, the total amount of water is about 60% of the body for the males, about 50% for females, and about 70% for infants. So infants need to be the most hydrated because they're about 70% water. You can see that the intracellular is the highest percentage for each one, and then the extracellular, we can break it down and we can see that it's the plasma and the interstitial fluid are the two big ones for the extracellular fluid. The water amount in our body comes from intake and output, so they should be equal to each other. The amount that goes in should be the same amount that goes out on a daily basis. So typically we can't, well, I won't say that. Okay, sources and water losses of water. So the major sources of water are from the liquid that we ingest, the coffee, the water, the drinks, soda. All those have water in them. And then also we get a good bit from our solid foods because our foods are typically moist. They could have some water content. And then we also make some water doing cellular respiration and our cell metabolism. So we make about 300 milliliters, which is it's a good bit of water that we make. And that's about a total of about 2,500. We lose water typically through our urine and our feces. The urine is the one that we have the most regulation on, and it can fluctuate up and down according to how much we intake. This is the one that we can control. The feces we can also control, but we need a certain percentage so we don't have diarrhea or constipation. So feces is typically one that we want to keep about where it is. And then we also have what's called insensible losses. These are losses that we can't measure. So we can measure the urine and the feces output, but we cannot measure the insensible losses. This is the losses from our lungs when we're breathing. We go outside on a cold day, we can see the water vapor come out. of our lungs, and then also the losses from our skin and sweating. We can't measure how much we sweat out during the day, so those are the insensible losses. Okay. Water moves through our body, throughout the body via filtration and osmosis. Filtration is due to pressure, and osmosis is due to the concentration of water. So water can move, also can move between compartments, so the intracellular compartment to the extracellular compartment, or back and forth. And it moves versus those is hydrostatic pressure, which is typically blood pressure, and then osmotic pressure, and this is the pressure that the solutes have. So the stuff that's dissolved in the water will pull the water towards it. That's how I imagine it, and it's osmotic pressure. How do we control our fluid balance? Well, there's a few ways we can do it and maintain homeostasis. The first one is through our thirst mechanism. So when our fluid levels are lower or getting lower, we have osmoreceptors in our hypothalamus, which indicate that we have low fluid, and that causes a chain reaction in our brain that makes us feel like we're thirsty. And then we intake more water. We also have the antidiuretic hormone, which is a hormone that promotes the reabsorption of water in the kidneys so that we don't lose as much water, and it's antidiuretic, so it's going to produce less urine and more water is going to remain in the body. There's also the hormone aldosterone, and this influences sodium primarily, and the sodium, if you go back to your notes on anatomy and physics, water typically follows sodium levels. So if sodium moves in that direction, the water usually follows what it is. And again, we're reabsorbing more water. And then lastly, we have the atrial natriuretic peptide, which is made by the heart. This peptide actually helps regulate fluid, sodium, and potassium levels by causing more excretion of sodium and more fluid that will go out through the urine. So it actually will produce more urination and more loss of sodium. When we have excess fluid inside the body, and typically in the interstitial component, which is the tissues compartment, we call that edema. So this is where we have extra fluid in the tissues, not in the cells, but in the tissues that are surrounding the tissue around the cell, in the interstitial compartment, in between cells. This edema causes swelling and enlargement of the tissue. It can be localized into one area, so we can have sprain our ankle and we can swell our ankle up, or it can be systemic, which means it's throughout the whole body. And that systemic is just going to primarily puffiness all throughout the body, and it usually shows a lot of weight gain, rapid weight gain. Typically, edema impairs tissue's perfusion because the fluid does not circulate through the tissue because the pressure is so high in there, and then it's also not going to allow the waste products to go in and out because of the problems occur. It can also trap drugs in the interstitial fluid for long term. Looking at how our fluid is regulated in our body, we can see that we have, this is a capillary, and it's going towards the venule up here, so the fluid's coming from the arterial to the venule. And we can see we have things like high filtration, which is due to pressure, high pressure in the capillary, then low pressure outside the capillary, hydrostatic pressure, and it goes out. We also have diffusion, which is from high concentration to low concentration, and that's how things move back and forth. We can also have osmosis, and this is due to the solutes. So we go from where there's a lot of solutes, from low solutes to high solutes. So the water is getting pulled back into the capillaries. This is osmosis is something, if you can't really remember well, you need to go back and look at your introductory chapters in anatomy and phys and go over osmosis, diffusion, and filtration. And then lastly, we have active transport, and this is all movement. Transport, if you want to look it up. And then there's a lot of good videos online also. And then we have active transport, is where we're actually pumping things in and out of the cell. This is a cell. We can pump things into it, and then that's going to influence the extracellular compartment. And therefore we can have active transport. It's the pumping. Some of the causes of edema, well, usually it's caused by differences in the pressures, the osmotic pressures or the hydrostatic pressures. Okay, and that's going to cause an increase in the amount of fluid in that area. So the first one is if there's an increased capillary hydrostatic pressure. So the pressure inside of the capillary, say for example maybe blood pressure or whatever, is higher, or we have an increase in blood volume, which is more blood. This is going to force the fluid, because the pressure is high to low, force the fluid out of the capillaries into the tissues. And one of the places we can see this happen is with pulmonary edema, where the capillary there's a backup. It actually gets backed up. The blood flow gets backed up, and that increases the pressure in the capillaries, and it forces the fluid out of the capillaries into the lung and causes pulmonary edema. Okay. We can also, another type of edema that can be caused is from the loss of the plasma proteins. The plasma proteins are solids inside the blood plasma. They cannot get out of the capillary, so they stay there. And so this is one of the solutes that actually pulls water and causes that osmotic pressure. The primary protein that does this is albumin, and it pulls the water from the interstitial fluid into the capillary. So if for some reason or another we don't have enough albumin or plasma proteins, then we have nothing to pull the water back. So the water goes out through the hydrostatic, but it doesn't get reabsorbed through the osmotic. So we have a decreased plasma osmotic pressure, and this causes a loss of fluid being returned to the capillaries and can cause edema in the tissues. Here we can see a few different things. On this normal capillary, what goes in is what comes out. We will have a net flow out, but the lymphatic vessel will pick it up. So there's a small amount, a net flow out, but the lymphatic vessel typically will pick it up. With this B, that we have an increase in capillary pressure. The capillary pressure goes up a lot, so it's going to force more fluid out, and then less fluid back in, more fluid out, and cause edema. For let's see, C, we have here an increase in the interstitial osmotic pressure. That means there's some kind of damage out here, usually in the interstitial fluid, and so there's going to be more proteins in that interstitial fluid, and it's going to pull the fluid to the interstitial side, because there's more solids out here in the interstitial fluid. More solid, so it pulls the water out. Maybe there's a burn. Okay. Okay. Then we have the last one is a blockage of the lymphatic vessels. Okay. The lymphatic vessels draw extra fluid out of the interstitial fluid, and because there's always a net flow from the capillary into the interstitial fluid, but if the lymphatic vessel gets blocked due to maybe a tumor or a parasite, this can cause extreme edema in that tissue, because the fluid constantly goes out into the tissue. And then the last one is where there is not enough plasma proteins, and so the osmotic pressure going into the capillary is low, and therefore we have edema. Okay. So the last two were, like I just mentioned, one was obstruction of the lymphatic vessels, and this is going to cause localized edema. We will see this more in the lymphatic section, where we see elephantitis, which is a parasitic worm, gets inside the lymphatic vessel and blocks it, and so it causes the tissue to have extreme edema. We also can have increased capillary permeability. If you remember, your capillaries are permeable. That means they let things in and out. Certain types of inflammation or infection, histamines, or other chemical mediators, they increase the permeability of the capillary. This is one of the parts that causes inflammation, and there's going to be more flow out of the capillaries. Also, this can come from bacterial toxins or large burn wounds, and this will cause widespread edema if it's spread throughout the whole body. Okay. Effects of edema: swelling, pale or red in color. So edema is going to cause that swelling, and you can sometimes have a little blood in there, so it causes the red in color. There's pitting edema. This is when there is excess interstitial fluid, and when pressure is applied to the swelling, it forms a depression or pit when you release the finger. This is pitting edema. Also, when it's systemic edema, we see that the overall body weight is increased, and this is with also generalized edema. So here's an image of some pitting edema where they push down, and you can see the pits with the swelling. Effects of edema, well, one of the biggest ones is functional impairment, which is where the swelling decreases the amount of the range of the joints. If it's in the lungs, it can reduce vital capacity, where we cannot breathe in as much oxygen or as much air into the lungs. And if it's in the pericardial cavity, then it can impair diastole. So those are some of the functional impairments. Edema can also cause pain because the pressure that exerts on the nerves. If it's in the brain, it can cause a headache. And it also in the liver and other organs. If it's inside those organs, it can stretch those organs and cause pain there also, in the kidneys and livers. Kidneys and liver. And also it can impair arterial circulation because the pressure, as it goes through the capillaries, decreases the amount of circulation in those tissues, and the circulation decreases, and that's going to can lead to low oxygen levels and ischemia, which can cause the tissues to break down more rapidly. Another effect is with dental work, because if the swelling is in the gums, it can make it difficult to make accurate impressions, and also it can cause the dentures not to fit well. And if there's edema of the skin, it can cause tissue breakdown from pressure. All right.